We're the station other stations are trying to beat.
Inspiration
92.3 FM.
Come on, everyone. Keep healthy. Keep healthy. Come on, everyone. Keep healthy.
Join Dr. Ameyo Stella Adadevoh, Draza Health Trust on Inspiration 92.3 FM Lagos every Wednesday from 11:30 a.m. to 12 p.m. for the Draza Radio Half Hour in celebration of Global Handwashing Day. They will be sharing stories and practical tips on how your hands can keep you healthy and prevent infections from spreading in your home and community.
Come on, everyone. Keep healthy. Keep healthy. Come on, everyone. Keep healthy.
It is your number one family radio, Inspiration 92.3 FM. This is still the tea break, and you are welcome to Draza Health Trust. Back again with another interesting episode of the Draza Half Hour, and this edition is dedicated to celebrating the Global Handwashing Day, which is observed on the 15th of October every year. And Draza Half Hour will be featured on Inspiration 92.3 every Wednesday from 11:30 to 12 noon. Now, Draza stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014, but later died after contracting the infection from the patient. And we know that her actions saved the lives of millions of Nigerians. Draza Health Trust is a non-profit public health organization established in 2015 to continue her legacy of protecting the health of Nigerians. And in the studio today, we have two members of the Draza team, and yes, they have come with juicy prizes, and you do not want to miss out on any of those. So stay tuned for a chance to win. Our first guest is a program associate at Draza Health Trust. She's a certified nurse midwife with over three years of experience in clinical nursing, school health and management of illness and disease, with focus in ensuring wellness in both rural and urban communities. Lagos, please welcome Nurse Christine Akoa.
Thank you.
Our second guest is a project associate at Draza Health Trust. She has experience in managing health projects and mobilizing communities to take actions to better improve their health. Ladies and gentlemen, please welcome the one, the only Moyosore Odumesi.
Thank you.
All right. Welcome to the studio. Great to have you both in the studio once again. So, Moyosore, as the world celebrates Global Handwashing Day, what important lessons should Nigerians learn?
Yes. Good morning once again, beautiful people of Lagos. Thank you for tuning in again today. And if you've been listening to the Draza Half Hour, you would know by now that we've been talking about hand washing all along. And for today, we'll be looking at hand washing in our various hospitals, whether it is a primary healthcare center, government hospital, private hospital. And I know if you're already thinking, oh, I'm not a nurse or a doctor, so this one no concern me, it's none of my business. Well, I'm happy to tell you that you are wrong. Because the truth is that at some point in our lives, we probably fall sick and need to be admitted in a hospital. And for this reason, I'm here to share with us some important moments we need to know about if we or our loved ones ever find ourselves in the hospital. According to the World Health Organization, these moments are known as the 5 moments of hand hygiene. And these moments are there for our health care workers, our caregivers to observe, so that they can keep the patient safe and keep themselves as healthcare workers or caregivers safe, and also prevent germs from spreading in the healthcare facility.
So what's this 5 moments? What's
okay?
It?
So
I would 5 magic words.
Maybe similar a bit, but I will try to maybe paint a picture to give us a clear understanding of what we're talking about. So when we're sick and we need to go to the hospital,
yes,
and get to the hospital, there's maybe a nurse that wants to take your blood pressure, or they send you to the laboratory to get some tests done, and there's somebody with a big needle to take your blood for for tests. I know we don't like that part. That part is not very pleasant, and we don't like it. But you see, before anybody touches you, to take your blood, to collect your sample in the hospital, before any procedure, make sure they wash their hands. Why am I saying this? It is to protect us as the patient, or in the position of the patient, from getting germs into our body or on our skin. Last week we talked about how direct skin to skin contact is one of the ways that germs can spread. So it is important for that healthcare worker that is attending to you to wash their hands, which brings me to the first moment of hand hygiene, which is before a doctor, a nurse or any medical personnel touches us or our loved one who is sick, they must wash their hands. They have to wash their hands before doing any procedure. And before this touching in this case is not like the regular handshake that we talked about last week. This is a bit more different. For example, when they have to check vital signs like maybe your pulse, blood pressure, or your oxygen level, or they want to check maybe your drip, as we popularly call it. They want to set line for your drip, or they want to adjust it. And maybe for people that find it difficult to urinate, they have catheters attached, and they want to adjust it or remove it so that you want to do something like that. They need to wash their hands. And even simple acts like they want to feed the patient, you want to bathe the patient, you want to help them dress up. It is important that the caregiver in this position or the doctor washes their hands before doing this. And this hand washing is a counter move, like a superhero move, because it protects the patient. The patient is already down with germs, and you do not want to add to the one that is doing them with your own germs that is from you, and you want to add to the patient only because you want to help them. So there's the second moment too, which is after dealing with body fluids like blood, saliva, mucus, or sweat. In the hospital sometimes we have spills or splash, and somebody will just throw up vom, and as a doctor or nurse, exactly, and as a doctor or nurse, you're thinking, okay, I'm wearing my gloves, I'm wearing my lab coat, I'm protected. Well, you might not be protected.
That gloves one, so they will not wash their hands, but wow. So what I'm thinking about is the fact that they will not wash their hands, right?
Yeah.
But then they just wear the gloves and they think, okay, just wear the
everything
gloves.
is fine.
It's
not right. It's not right.
I'm supposed to wash. They're supposed to wash their hands
before
then
putting on that
yes,
glove.
yes.
Yeah.
Because you don't know these vomits, tiny. As we said, microorganisms, germs, they are so small and tiny that we can't see them. And it's splash. One germ will just hang on your hand, and they're more there. I really don't know, and they have it. And this second step really is not. It's more of to protect us as if you're the healthcare worker, or you're providing your relative staying with your sick patient to protect you, because in the process of taking care of somebody that is sick, you really don't want to come down with an infection for yourself. So it is very important that you wash your hands before you allow the healthcare worker to wash their hands before any procedure that they have to do, or you yourself as a relative or you have your loved ones, before feeding them or helping them with things. And after you touch, maybe you help them clean their wound or their vomit, your packing vomit, or any body fluid at all. Yeah.
All right. So let's see your number one family radio inspiration 92.3 FM. We'll take a short break and we'll be back. Stick with us. Don't go anywhere.
Come on, everyone. Keep healthy. Keep healthy. Come on, everyone. Keep healthy.
Join Dr. Ameyo Stella Adadevoh, Draza Health Trust on Inspiration 92.3 FM Lagos every Wednesday from 11:30 a.m. to 12 p.m. for the Draza Radio Half Hour in celebration of Global Handwashing Day. They will be sharing stories and practical tips on how your hands can keep you healthy and prevent infections from spreading in your home and community.
Come on, everyone. Keep healthy. Keep healthy. Come on, everyone. Keep healthy.
I love that tune so much. All right, welcome back to See Your Number One Family Radio Inspiration 92.3 FM. If you're just joining us, we're live with our guest from Dr. Ameyo Stella Adadevoh Health Trust, who are shedding light on this fascinating topic that is all about keeping sick people, medical people, and the hospital environment clean and safe. So it's a win-win-win situation, right? The phone lines will soon be open to take your questions and also for you to answer some quiz questions that they have prepared. So I hope you have been listening, because it's in your listening that the answers lie. And so it's about that time when you have a chance to win the Draza Hygiene kit. You should know that the kit contains a branded t-shirt, a big Turkish towel, a thermometer, an insulated water bottle, and of course a liquid hand wash and hand sanitizer to wash your hands and keep them clean. So you can send your questions via WhatsApp to 0817 313 6193, 0817 313 6193. Now, Nurse Christine, we've listened to 2 of the 5 moments for hand hygiene. Let's know about the remaining 3.
Okay, thank you very much. So the first was before touching the patient. The second is after coming in contact with the patient's body fluid
Projectiles.
and all of that. So the third moment we'll be talking about is after touching the sick person. That is washing your hands after you've touched the patient or your sick family member or anything at all in their immediate surrounding. The reason behind that is because germs can be easily picked up by our hands, right? So for example, after touching the sick person, maybe you help them go to the toilet or helped them to stand up, for those that are like bedridden, and you help them, or after you've dealt with their medical appliance or equipment that's connected to them, like the drips, that's the IV pumps and all of that. So we need to ensure that the caregivers, which is like our relatives, our family members, or the healthcare workers, and then the health environment is what's safe from patients' germs. Because I have germs, you have germs, no matter how we try to avoid it.
We all have germs.
We all have germs, yeah. So remember that washing your hands before you touch the sick person is to protect that sick person from germs, while you're also hand washing to protect the patient and yourself. That is, you're protecting yourself and also protecting the patient at the same time, so everybody is safe. So the fourth moment is before performing any kind of super clean and hygienic procedure. Say in the hospital setting, for example, you come in contact with some sterile procedures that you make sure nothing called germ or dirt is on that procedure. Say you want to open a patient in the theater now, you make sure there is no germs coming from the outside environment to the patient's body inside, right? So this particular fourth moment is to make sure that germs do not come into the patient body. So we're talking about the environment here. Why are you laughing? We're actually talking about the environment here.
I know someone is sick and then, wow, sorry, there's one small germ inside your body.
No, we're trying so hard to make sure that doesn't happen. So yeah, so this fourth moment is particularly to protect the patient from harmful germs, making sure nothing unwanted gets into their body, not even their own germs. So you can see how serious it is.
Yes, it is.
So for example, you're handling wound dressings. Those are like procedures we do in hospitals. Wound dressings, dealing with things like the urinary catheters, that's like the urine bags for those that cannot pass out urine by themselves. So that's what the fourth moment is all about. Then the final moment is after touching anything around a patient or a patient's surroundings. In essence, it's different from before and after touching the patient. Right now, we're focusing on the environment of the patient. Like when you come to visit your family member that is sick or something, maybe you just say, please help me turn off or turn on the lights. Help me keep this bottle, my water bottle on the... You see, you're touching, you're already touching, even though you don't touch the patient directly, but you're touching the things they are using. That's the environment. So after you do that, you need to make sure you wash your hands. They will say, but I didn't touch this patient, do I have to wash my hands? Yes, so your relative, visitor, anybody coming in, please wash your hands, because now small they take back germs with hands, you know go know. So the brief of all these moments is that two of these moments, which are before touching the patient, that is number 1, and before any super clean procedure, which is number 4. You see these two that I just listed, they are majorly to keep the patient safe and keep me, the health worker, safe. Now the remaining 3, which I just talked about, after touching the patient, which is moment 3, after coming in contact with body fluid, number 2, then after touching the patient's environment, number 5, those ones are all necessarily about the healthcare workers. Like the caregivers, like the relatives or the doctor or the nurse. You see those 3 moments, they are majorly for them. So even if it is about keeping everyone safe and healthy, we need to ensure that everybody, including the little of all, is safe. So next time when you see healthcare providers doing any quick hand wash, they just use water alone. Auntie, uncle, please wash your hand. So these are just the important moments we need to be aware of. So if you're noticing they are not doing it, please just politely remind them.
Politely, auntie, please
just wash.
Let me message says good day to everyone in the studio. They will not hear. And when the patient tries to tell them, they will get angry and say, you want to teach them their job.
Exactly.
Or purposely do you one wickedness.
Exactly.
I fear our healthcare practitioners, because that's why Nurse Christine is here to talk on behalf of the...
I'm looking for our people.
Exactly. All right, so the phone lines are now open for listeners out there to call in to answer questions about what has been discussed so far. All right, we're giving prizes to the top 5 callers who answer correctly. So we hope you have been listening well. Only 5 prizes to give away. So get ready to dial in. The number is 0700 923 923 923. That is 0700 923 923 923. Also, if you have any questions for our guests about anything they have spoken about, please send them a message. Send us a WhatsApp message on 0817 313 6193. 0817 313 6193. That's where you send your questions. If you want to answer a question and win a chance to win a goodie bag, just to tell you what is in this goodie bag, it contains a branded t-shirt, a big Turkish towel, a thermometer. Who knew that you need a thermometer at home? Yes, you do need a thermometer at home. An insulated water bottle, and of course, liquid hand wash and a hand sanitizer to wash your hands, just to keep them clean. All right, so call us 0700 923 923 923 is the number to call. We have a first. Hello. Hey. You know what she had before calling. You know what she had before calling. That's what it means. 0700 923 923 923 is the number to call to answer a question and win yourself a goodie bag courtesy Drasa Health Trust. All right, 0700 923 923 923. Hello.
Hello.
Hello. Good morning. Hello. Good morning.
Good morning.
Welcome to the show. What's your name and where are you calling from?
Okay, my name is Adadevoh. I'm calling from Jiralake.
Edidion.
Yes, from Jiralake.
Or from where?
Oshodi.
From Oshodi. All right. So, Edidion,
Yes.
pick between number 1 and number 7.
Number 1 and number 7.
Number 1, between number 1 and number 7.
5. Number 5.
Number 5. How many, are you sure you're listening? How many of the moments protect patients?
Please, can you say it again?
How many, you know we mentioned 5 moments. How many of those moments protect patients?
2.
Alright, are you sure?
Yes, I'm sure.
Great.
Sorry?
No, congratulations. Congratulations. We're happy for you. Do you want to get bonus and mention them?
Sorry.
We can leave our
I don't know. Okay. Alright, Eddie Young, stay on the line. Alright, stay on the line. We'll be right back, Lagos.
Okay.
It is your number 1 family radio, Inspiration 92.3 FM. The number to call is 0700 923 923 923. We still have 4 goodie bags to give out. Shout out to Edith Young, who has gotten her own. She has won herself a prize from Drasa Health Trust. Do we have a second caller? Hello.
Hello.
Hello. Good morning. What's your name and where are you calling
Good
from?
morning. I'm calling from Ameyo, Dolphin.
All right. What's your name?
My name is Gloria.
Gloria. All right, Gloria. Are you ready? Are you ready?
Yes, I am.
Pick between number 1 and number 6. Number 5 is gone.
Okay, number 2.
Number 2.
Yes.
List 5 examples of items found in a patient's surrounding.
A drawer,
Yes.
a drip stand,
Good.
Yes.
a bed,
Yeah.
a bed sheet,
Yeah.
if that's an item, and a pillow.
And the what?
A pillow.
Nice. We give it.
Congratulations.
She almost said Macintosh. She don't work for hospital before.
Gloria, please stay on the line. Please stay on the line.
Okay, thank you.
It's your number one family radio inspiration 92.3 FM. Gloria, please send your name and number to our WhatsApp platform right now. Please send your name and number to our WhatsApp platform right now. The number is 0817-313-6193 right now, as in right now, before we leave the studio. Okay, we still have goodie bags to give out. We have like three more to give. Three more to give out. 0700 93 93 93 is the number to call. 0700 93 93 93 is the number to call. We have been talking about hand washing, and we've spoken about 5 moments that are very important for you to pay attention to. 0700 93 93 93. Congratulations to Edith Young and congratulations to Gloria. All right, 0700 93 93 923. You're getting a gift bag courtesy Drasa Health Trust, and in that kit contains a branded t-shirt, a big Turkish towel, a thermometer, an insulated water bottle, and liquid hand wash, and hand sanitizers to wash your hands and keep your hands clean. So send us a WhatsApp message if you have any questions concerning the conversation today, or if you like to win yourself a goodie bag, call us on 0700 93 93 923. That is 0700 93 93 923. So let me ask, in a situation whereby you've reminded the doctor or the nurse and they, just like the person mentioned earlier and said, they change it and they switch it up, what do you do in that kind of situation?
It's just simple.
Shout. No,
we're not mad people now.
They want to kill me.
I think that's why you can talk to the matron. At least let them know, you just politely spoke to this doctor or this nurse, and this is what is happening. There's no how they would not handle the situation in a manner that will at least be mutual in terms of, please just wash your hand because this patient has to be safe. So let peace reign. Let it not become
because I'm thinking of, not to call, but Dr. Dim. Hello, good afternoon. Good morning. Hello,
good morning. I can hear you.
yes, I can hear you too. What's your name and where you calling from?
My name is Precious. I'm calling from Surulere.
Precious from Surulere.
Yes.
All right, Precious, pick a number from number 1 to 6. Number 2 is gone, number 5 is gone.
Number 3.
Number 3. All right. List 3 activities that involve a caregiver touching the patient or sick person. List 3 activities. 1, 2, 3. List 3 activities that would involve a caregiver touching a patient or a sick person.
Fixing the catheter.
Fixing their catheter.
Okay, 1.
Setting a line.
No. In this case,
And cleaning the patient.
okay.
They are caregivers.
Let us give us one more.
They said give us one more. My Oga says give us one more.
Setting a line.
What's going on?
Did we lose her?
Hello, Precious. Hello. Oh, come on.
Hello, I can hear you.
Yes,
Okay.
we said give us one more,
So setting a line, fixing catheter.
and then one more.
cleaning up a patient who vomited.
Awesome.
Are you
Give
ready? Awesome. Congratulations, Precious. Please send us your name and number to our WhatsApp platform right now.
Is this the same WhatsApp number?
Yes, 0817 313 6193.
Sorry, 1 second. 0817.
313
Okay.
6193.
Okay. 0817. Okay, yeah. Okay, I'll send it right now.
Yeah, please send it right now. Thank you so much. Congratulations. That's 3 winners, right?
Yeah.
We have 3 out of 3 now. Oh, my people there.
Just give us 2 more.
Yeah. So we have 3 out of 3. So we're going for 2 more.
Yeah.
We're going for 2 more. 0700 923 939. Oh, we are running out of time. We are running out of time. We have just 2 minutes left. But I think let's we can see how good was, and if anybody comes in, calls us before we're done, we can take that call. Let's go.
I don't. Guys are not calling. I don't understand.
What's up?
They are thinking about their lives. They are thinking about their lives. All right. So, thank you so much, guys. So let's wrap this up.
All right.
Okay, so we're glad to have you tune in again and share your time with us on today's episode of the Drasa Half Hour. Remember that this edition is to celebrate the Global Handwashing Day, which is marked 15th of October every year. And once again, we are Dr. Ameyo Stella Adadevoh Health Trust, called Drasa for short, a public health non-profit organization working to develop health champions like you and I. So you can follow us, feel free to follow us on our social media channels at Drasa Trust on Twitter, Instagram, and Facebook. That's our username, because we want you to be a part of our 50,000 health champions in our network who are always ready to take charge of their health and helping their loved ones and communities to do the same. So tune in next week, same time, same station.
All right, thank you so much. Coming up at the top of the hour is the world news. 12:15, Baribuno is here with Sport Waka, and at 12:30 we make a return on the midday rewind. All right, so stick with us. Don't go anywhere. This is your number one family radio, Inspiration 92.3 FM. Don't go anywhere. Thank you so much, ladies.
Thank you.
And thank you to Chief Christopher for overseeing. Thank you so much. All right, Lagos. Just will be back next week, Wednesday.
Yeah.
At 11:30 a.m.
Thank
Stick with us. Don't go anywhere.